This is NHSA's Program of Excellence informational webinar. So hopefully you have made it to the right spot, meaning that you are interested in learning more about the Program of Excellence and hopefully become an applicant this year for our 2024 cohort. So I'll go ahead and jump right on in. The first thing I like to do is I like to start with NHSA's mission whenever I'm doing any presentation, especially a presentation about a program of excellence for the National Head Start Association. And so we're compelled to fulfill our mission there by the promise of all possible outcomes. And we have our 4 outcomes there. And that's one powerful, united Head Start voice. And whenever I think about program of excellence, I think about how this is a way to amplify that voice. It's a way to call out the programs who have excellence in what they're doing, and to be able to share that back out to the Head Start field so we can leverage that and continue to grow our programs within Head Start. And also a collegial collaborative Head Start field along with that first one is there's a lot of really fantastic things happening out there in the Head Start world, and we need to make sure that there's a way to get that information from all of the different corners of our nation to make sure that everyone is sharing that and that we're collaborating on it. If it's working in Oklahoma, it might also work in California and other places across the country. And then, of course, nonpartisan support of increased federal commitment to Head Start, to be able to call on to these program of excellence programs and to be able to call on their senators, their congressmen to be able to say, if there's something going on in your state, these are the folks that you want to reach out to. They're going to tell you all about Head Start and invite you into their program as well. And then all of that leads to a healthier, empowered children and families and that stronger, more vibrant communities. So here's our agenda today. And while you are reading the agenda, I'll tell you a little bit about myself here. I'm Christina Ellis. I'm director of the Academy at NHSA. And prior to joining NHSA, I was in a Head Start, early Head Start program in Tulsa, Oklahoma called CAP Tulsa for about 13 years, doing a variety of different programming, as well as some time spent at the YMCA, where at both of those locations we were NACE accredited, as well as we were a program of excellence through NHSA. And so what we're going to be talking about today is an overview of the program, a little bit about why apply, how to apply. We're going to have Celeste, who is on the call today. Her program is a program of excellence, and she's going to be able to answer any of your questions, because I can tell you all about it from my perspective, but her program just went through it and received the honor. And so I know that you might have some great questions for her as well. And then we're going to open it up to questions after that you might have. So what is the initiative today? So right now it is the mark of quality, and we have a framework known as the indicators of excellence. So that's the questions that are on the application. It's going to reflect established performance criteria. It's going to get evidence of the way your program goes beyond meeting Head Start program performance standards. We know you have to meet the program performance standards in your federal reviews. So this is the way to be able to do it in a safe space where you can tell us what you're doing in your program and where you're maybe going above and beyond what those performance standards say, and also to describe the best and most effective practices for motivating and helping programs make improvements. So history, quality matters. It's always mattered at NHSA. And so this was actually developed in the 1990s. And you could see there, I've got a couple of different logos of what it has used to look like. And you might be familiar with it because maybe there is a plaque or something sitting at one of your programs where you had been a program of excellence before. And it grew out of our initiative to improve and highlight program quality. And we wanted to look at quality operations and practices in 10 program areas. And at the time, there were 2 levels. There were Program of Achievement and Program of Excellence. And then that first award was awarded in 1995. It was redesigned in 2015. And so you're going to see our new logo, our old logo up there. And then we also added criteria in 2023. And so if you have looked at the quality indicators from our Learn More section, I believe it has 41 quality indicators listed. That has grown to 46. And so you'll be receiving new quality indicators where we've added just a couple of different questions, as well as combined some where there were duplicates or that the question wasn't as clear as we thought it had been. And so we do have new criteria as of this last year. It's feedback obtained from Head Start program directors, both participants and non-participants of the quality indicator program. And so we listen to the field, what is important to you, what do you want to know about, and then we will add that into our program indicators or tease that out more from our programs so that we can capture it and share it back out to the field. We accept 25 applicants to go through the first phase every year. And we had 13 programs awarded Program of Excellence in 2022 out of the 25, and then 11 programs this last year who met the qualifications as well. And so quality indicators, you're going to hear that word quite a bit. Those are our questions, and they're divided into 3 sections. Organizational development, that's where we're going to be talking about things like your mission, your assessments that you have, and then your engagement with family, and then program enrichment and innovation. There's quite a few questions on enrichment and innovation. And this year, some of our innovation questions do not count against your application. It's just good information for us to share back out to the field as well. So here's an example of an indicator subsection and category example, because I know, like many of you, you're like, I want to get my hands on what these quality indicators look like. What am I really getting myself into? And so here is an example from our first quality indicator, and that is, how does the mission guide the program's operations? You're going to see here at the top, it says suggested evidence. Sometimes it's going to say suggested, sometimes it's going to say required evidence. So if it's required evidence, it needs to be in there, or you wouldn't get the credit and the points for that quality indicator. So this one suggested having your vision statement, your mission statement, and your core values, and providing that in your application. And then we also, it's an open book test. We tell you exactly what the question is. So you can see that scoring criteria. So if this quality indicator was worth 20 points, A, B, C, and D would be worth 5 points each. So if you answered A with enough detail to let us know if you met the indicator, you would get your 5 points. And so you would be able to see that. But if you just didn't answer D at all, you would automatically be at 15 out of 20. So again, open book scoring, open book questions. There isn't any sort of hidden or got you kind of a situation here. We really think of this as a safe way to be able to check on your program, to get ready for something like a federal review, your focus area 2, to be able to take a look at what you're doing in your program and share that back out. And then there's also questions to consider, which are just additional support to get your team thinking about how you can respond to this question. So what the accreditation means. It's a 3-month application process, and virtual meetings gives programs an opportunity to showcase all the facets of your program. It's an opportunity for you to shout from the rooftops what a wonderful job your program is doing, and also to be reflective of, here's some areas where we can make some improvements on, and this is what we plan on doing to get there. And so it lists here some of the things: transparent and sound fiscal stewardship, highly experienced and educated staff, if you have state-of-the-art programming, quality services that reflect and respond to the aspirations and needs of children and families. Just a couple of examples of what we're trying to make sure we're getting out of our program of excellence awardees. The benefits of participation is a thorough Head Start specific organization evaluation. We are looking at this through the lens of Head Start. So whenever this is an accreditation where it is specifically looking at your Head Start related to the Head Start program performance standards. Like I said, it's a really sort of soft launch also for a focus area 2 visit. And so it's an opportunity for maybe if you have new staff who haven't gone through a focus area 2, for them to have that understanding of, I've got to collect things to be able to showcase this and be able to speak to what I'm doing in these different service areas. Identification of strengths and coaching and areas for continuous improvement. Your letter at the end, letting you know whether you had met the qualifications or not, they are going to provide you areas of strengths as well as areas of continuous needs. So you're also going to get that from us in a formalized letter. But I could tell you from the people I have talked to in the programs that have gone through this, they have made that recognition as they're doing their application of the areas where they can make improvements as well. The other thing is an announcement sent to your senators, representatives, and state governor. Through this, we had a lot of them reach out to the programs and ask to take a tour of their program, or when there was a change happening to early childcare in their state, they also reached out to these programs to say, tell me what's going on here. Would this be able to benefit your program as well as others? And then recognition at our conferences as well. And so the programs are invited to our Winter Leadership Institute, where they receive their plaque and have outward recognition of their achievements as well. You also get access to the Program of Excellence logo, as well as a kit that will help you communicate this back out to your community, to your teachers, to your governor, to the media. You'll have access to that, along with some swag of things that you can post in your school centers or that you can give out to your teachers or to your staff members. People have a whole lot of fun with it. We had a program this last year create billboards in their community that said, you want to work at a program of excellence, program, or send your children to an accredited NHSA program of excellence center. I was just at the parent conference in New Orleans, and there were t-shirts that everyone was wearing that said, my program's a program of excellence. Just really wonderful stuff, celebrating the accomplishments that they've had. And then, of course, entrance into a community of the best and most innovative educational programs across the country. It's the group we go to first at NHSA. Whenever we need panelists at our FLI or WLI or other conference, they reach out to the Program of Excellence folks first and say, okay, who wants to come and talk about father engagement or about challenging behaviors in the classroom? And then that's where we're going to go first to get that information to be able to share out. So here is the application overview. The first thing is a program profile. That is evidence of full compliance with the Head Start program performance standards. So it's your latest review saying that you are in compliance, or if there was a finding that you are on a plan to remedy that finding, evidence of financial integrity, so your last audit as well. And then a brief written narrative description below the families and communities served by your program. So what you do an annual report every year, or you do your PIR, that's the information there. And then there's going to be a demonstration of innovation, and that's the written narrative responses. It's a lot of written narrative. So not only are you gathering all the documentation, there is time and ownership of what those narratives look like, because we read the narratives first, and then we use the evidence to back up that narrative and show proof of that narrative. And then demonstration of comprehensive quality, again, addressing those areas to meet or exceed the indicators of excellence. And so what does that look like? It takes 3 months to complete, February through April. So you have access to the full application in February. Your documents are uploaded online, and then they are starting to be reviewed in May and June. And then you have your determination in July. So there is also 3 online sessions. And you can invite as many people from your program to that. We just ask that you have at least one person representing your program on those online meetings. It's an opportunity to ask questions, for me to give any updates or anything that has changed in that process, to make sure you have all of that. There is an application fee. You can see that there. And then that goes to pay our professionals who are reviewing your application. So every application gets 2 reviewers, and those reviewers have extensive knowledge of and the experience in Head Start, early Head Start, that review those applications. So you have 2 reviewers per application. And then also your award is for 5 years after you receive it. You also get program support. Again, this is a lengthy application. It takes 3 months to complete. A lot of hands are in this application as you're submitting it and moving forward. So we provide training. So we provide training on and documents on where you should upload them, how they should be uploaded, to make sure that you can be the most successful and not get caught up in something like naming your PDF the wrong thing and we can't find it. So we provide training for that. And there's also a narrative template. So sometimes we have different ideas of what brief means. So it might say, write a brief statement, and that could mean to one person 5 pages and to another person 1 paragraph. And so we give information on what that looks like and give examples as well using previous programs' narratives. There's also an application question and answer document that we've put together that's provided to you as well. We take questions that we're going to get today, questions we've had over the last 2 years, and anything that comes out throughout the process during this cohort, to make sure you have an up-to-date Q&A document that you can go back and refer to, that you can give to other staff members that are supporting you. And then you have me and other people at NHSA. People will sometimes, because I'm not a reviewer, will send me their narratives to just make sure they're on the right track. And I can give them some tips of, too long, too short, or didn't meet all 4 of the criteria, that kind of a thing, or just any other questions that you have, or if you want me to come talk to your staff in a Zoom meeting, I'm available there for you during those 3 months as well. So eligibility, you do have to be an active and current NHSA member. If your program is not a member right now, we can work that out, get it all set up, so that way whenever the application is ready to be submitted, you are already a member. Like I said before, full compliance with Head Start. You are currently not subject to competition, and that also there are 25 programs. So the 25 programs that are selected are the first 25 that meet these qualifications and pay. So it's very simple. We keep it nice and clean. And I think right now we have 10 programs that are signed up. So we've got about 15 slots left for this cohort. And so again, earlier I said, I can tell you all about it, but I haven't gone through the experience of being the program person on the other end. So we've invited Celeste. She's the Head Start project manager for Community Action Council, and she is a 2023 Program of Excellence. So I'm going to turn it over to Celeste to give you a little bit of information about her experience.
Thank you, Christina. Hello, everyone. I am really excited to see so many folks on this call and to hear that 10 have already registered for Program of Excellence. I think that's fantastic. I do want to share with you guys some of our experience. Like Christina mentioned, we did just receive our award as a Program of Excellence at the Winter Training Institute in DC. So why do Program of Excellence? You have to pay to do it. It's a lot of work. It's a big process. It can definitely seem daunting. One of the big motivators for our program actually was just to have the bragging rights, to say that you've been a nationally recognized program. It's a big deal. And I think that, even more importantly, it really gives everyone in your agency, everyone who's involved in your application process, a good look into what makes your Head Start program special. There's no one on this call that can't successfully do this. The fact that you're interested means that you probably have a great program and you're going to succeed in this process. So I think there are a lot of good reasons, but for me, the best part, the best takeaway was definitely being able to learn everything that I did learn about our program. Now, to get through the process, like Christina mentioned, it is several months. There are, I believe, still 41 indicators. Is that right, Christina? So it is, significant. I definitely recommend from the start, have a designated person who's going to be your point person. Okay, Christina says 46 quality indicators, so a little bit more this year. You want to designate one person who's going to keep everyone else in line. You will not be able to do this on your own. This is a process that certainly takes input from every area of your organization. So, of course, that depends on the size of your organization, but for us, that meant program staff, human resources, facilities, IT, fiscal staff, everyone you could think of. It was very much an all hands on deck type of thing. But it does help to have one person who is gathering all the information, editing the documents, ensuring that the question has been answered, those sorts of things, really to just help you keep everything organized. So I definitely recommend making sure you have everyone on board with the process first before you move forward, because it can be very difficult. I'm sure some of you already know, to get information from all those different resources when you need it. So definitely get a team together and start early. As soon as those questions open up for you in that portal, I would recommend go in, look at all of them, and assign each quality indicator to someone or to several people. So, for example, we had some human resources type of questions. I immediately sent those to our HR director. She assigned different areas to different staff. They put it all together and then they sent it to me. Having that listed in the beginning is really going to help you stay organized and figure out what you need to get and who you need to get it from. And of course, that can change as the process goes along, but very helpful for organization and to just make sure you have that buy-in from all of the necessary staff. So really, why recommend other programs do it? That was probably the best question that Christina sent me. I absolutely fell in love with my program after we did Program of Excellence. I already liked it, of course, but I think sometimes in Head Start, especially with larger programs, we actually have 4 Head Start programs. We have about 1,900 children. So we do sometimes have a tendency to get siloed in our areas of interest and our areas of expertise. And, sometimes that just happens. So to be able to take a step back and work with staff from all across our agency and every level of our programs, and to see the impact that we really are having on children and their families and our communities was really spectacular to me. I learned so much about our programs that I didn't know. It really came away with a lot to be proud of. And I just can't recommend this process enough. Like I said, we were awarded in DC. So, we tell everyone every chance we get that we're a program of excellence. We're very proud. We have our plaque proudly displayed in our office. We have been posting on social media. We're getting ready to do an event for our Head Start families to celebrate. So there's a lot of good to it. If anyone has questions, I'm happy to answer those too. But yeah, I absolutely recommend it. I think if you're on this call and you're already interested, that is really all you need to get started. Just go into it with a team mindset, because you are going to need everyone involved. And make sure you just use your time wisely, really try and meet those marked deadlines throughout the process, and that'll give you a really good start.
Thank you so much, Celeste, for coming today and for sharing your experience. And it's perfect. We are going to open it up to questions now. You can put your question in chat, but we also have a small group. So if you want to use your reaction or just come off mute as well, this is a great time to ask me or Celeste any questions that you have.
Hi, I'm Jennifer Balcom, and I am interested, but I have a question. Did you say you get the questions before or after you sign up for the program? Then you get the list of questions.
So right now, the list of questions are out there, but they're
Okay.
in sort of a very summarized form. So if you go to the quality indicators, you're going to see the 41 that were from last year. Like I said, there are a couple of extra ones for this year. Nothing that's going to throw you off. Like I said, we go back and look at the Head Start program performance standards. There might be an extra one or two about family engagement. But if you see those quality indicators, they're going to give you a summary, and it's going to say something like, describe your mission statement and how you use that to meet your goals. But then the actual application is going to list that A, B, C, D. And so that's whenever you'll see all of it, all of the subparts that you need to answer for how the mission statement drives your program goals. Great question, Jennifer. Looks like we've got one in the chat. Do you have to be invited to apply? A fantastic question as well. No, you do not have to be invited to apply. It really is for all, like what Celeste said. Celeste, I love it whenever you said that everyone on this call is probably eligible, you're probably a member, you're in good standing, and you can do this. It's really just telling your story, and you know your story and your program. So it is open to all. But because the amount of reviewers and the timing, we accept 25 a year. And so again, to not put you through a variety of applications to get to the application, it is the first 25 that qualify and pay. And the qualifications are in good standing with Head Start and the NHSA member there. And also, whenever I say paid for, that includes PO. So I know a lot of our programs do a PO and they don't have, or they're not able to pay with credit card. Or if you're in a situation, which I have heard before, where you're wanting to put it into next year's budget, you just need to send me an email and we'll take care of you, because we have some programs that it's technically due this year and you want to pay for it out of next year's budget. So we can work those kinds of things out as well. You just have to send me an email and let me know if your program falls into that situation. Any other questions?
There
I
is
did
one
want
more
to
in the
add,
chat.
Oh, go
Christina
ahead.
actually
I'm sorry,
said,
Celeste.
yeah, that's okay. Christina actually said earlier that this is a good way to get a jump start into your FA1 and your FA2. I could not agree more. Fortunately for us, we had recently completed our FA1 and FA2 right before we started Program of Excellence. And so we were really able to use a lot of the data that we had prepared for the FA2 to answer some of the questions at the QI in the Program of Excellence. So whether you're going into it or you've already done it, definitely think the two tie into each other really well. So make sure you use that as a resource for yourself.
Thank you for that. And then our lovely producer, Rachel, reminded me that there was another question I skipped over. So sorry, Sharon. Sharon, you do not have to be an accredited program before applying, whether that is with NHSA or another governing body like NACE. You do not have to be accredited already. We have programs that have re-upped their accreditation every 5 years, and they've been with us since 1990. I think PICA, Parents Incorporated.
In
Yeah.
community action.
Yes, Parents, yes, in community action. They've been with us since the beginning as well. So there are several programs that have been a program of excellence since the 90s. Okay, I'm going to see if you will get the slide deck, and this is recorded. And so if this is information you need to take back to your program, Celeste, I think you did a wonderful job, especially explaining that you can't do this alone. And for it to really be a group decision, we have 25 join, and there's usually every year, and there's usually about 3 or 4 that whenever they get into it, they realize they didn't have the capacity to really complete it and see it through. And so they might defer for another year. And so it really is a big decision for your agency, but I really do think that the payoff at the end is definitely worth it for your agency. Also, if you need me to get on a call with anyone else at your organization to walk through this, I'm happy to do that as well. You just need to send me an email. And I want to say Rachel has been putting that, or she will be putting that in the chat. And then Adrian, I think maybe you went off mute. Do you have a question?
Yes. So I have two questions. One, our program is in the full enrollment initiative. Would that have a say in the application?
No. So, maybe two things. I have two things here. So, that doesn't push you over here further into getting an application, because think of this first step is registering. What you're essentially doing is registering to
Okay.
receive the full application. And that's where the first 25, and everyone is in the same sort of bucket. It's essentially, are you a member? Did you pay your fee? And if that's there, you are officially registered to receive the full application. And then whenever you receive the full application, it's going to be based off of those quality indicators. And if that's not listed as a quality indicator, it can go in the good information for us to have to be able to get back out to the community, but won't necessarily give you more points to get an approved application. Does that make sense?
Okay. I thought it was going to have a negative effect, because we have a plan submitted to the Office of Head Start. We're working with them. We're gradually seeing the results of the initiative. So that was the rationale for the question.
Yeah, it's really the programs who we've had to stop their application is if they haven't started that process yet. We have some programs where it's very fresh and they haven't had a time to talk to their regional association or the Office of Head Start yet, and that we just don't know what the outcome is going to be, that will put a hold on their application. But if you already have a plan and that's already been submitted, then you're able to move forward with it. But again, if it's not a finding on your latest review, you're able to move forward.
Okay.
Great question.
From your experience, what you just mentioned, are there any things that as a potential applicant that we need to pay attention to, or anything that has delayed the application or classification for other programs?
Yeah, a couple of things that I've seen is whenever there is not a person who is reviewing all of the applications before they're submitted. And so like what Celeste said, you can't do it alone. You're going to be sending information out from a lot of people, like your HR department. But if your HR department isn't that great at writing narratives, and you just think, oh, I've got it, they've submitted it, it's fine, and you don't have someone reading through it to make sure it hits all of those pieces that are requested, then I've seen agencies where you could tell that it was written by so many different people who didn't get the memo on how to write the narrative. Like they didn't get the training or the documents passed on to them. Someone just said, I need you to gather some HR documents for me, without any sort of context of completing this narrative and submitting that along with the documents. So Adrian, that's what I've seen in the past, where programs have had to go back to their folks and ask them to rewrite it, and sort of have that CQI, that quality check within their own organization before it's officially submitted, that it does have all of the parts.
Okay. I'm highly interested, and I think like what you just mentioned, it will be a group effort. But I think more than likely we may ask for another short meeting with my key leadership staff.
Oh, absolutely. Would love to have meetings with anyone that needs it, as well as once you get into this and you need additional support for your staff, like I said, we provide a couple of documents, but sometimes they might have questions. They also can come to all of the meetings. We have a meeting every month. And so you can include, once you get approved to move forward with the application, then they can come to those meetings as well. So everyone is hearing it. It's also recorded. So then you could also send it back to your other staff as well. But as long as that communication is flowing down and up in every which way, like what Celeste said, you all have the ability to pass this application. If you are a Head Start running an excellent program or interested in self-reflection, you're going to do just fine.
Perfect. Thank you.
Any other questions? Okay, well then, and then Celeste put a recommendation in the chat as well, so also take a look at that. And I'm available. I could stay on this call. I'm going to stay on for just a little bit in case anyone has something that's specific to their program that they need to have answered. But we'll go ahead and let everyone go for the rest of the day. Enjoy the rest of your Tuesday. I really hope to see your applications come through. It is my favorite thing to read about all the wonderful things happening across the country with our little programs that have one building and 5 classrooms to our large programs that are spread out in all of these, suburban places, rural places in their communities. I love reading all the things that you're doing. So I hope to see your applications come through. And again, reach out if you have any questions. Thanks, everyone. And I'll stay on the chat on the line here in case anyone has any specific questions. And thank you, Celeste, for your time today.